In this podcast, we're going to be speaking to Brian Todd, who's a consultant spinal surgeon at Stockport NHS Foundation Trust. And Brian's going to be telling us about the Wallace ligament. Now, in the days since I was a registrar, there have been a lot of changes in spinal surgery, and I'd never actually heard of the Wallace ligament before. Could you tell us what it's for?
Yeah, it's an interspinous device. It's used in the lumbar region in particular patients who are having specific surgical procedures such as discectomy, where the disc's massive, or revision discectomy, or in spinal stenosis, which is a condition where the spinal canal narrows, usually in older people, and you have to open it up by removing bone and ligament from the spine. So the Wallace ligament is inserted in an effort to reduce back pain following these procedures.
Right.
Traditionally, if you wanted to do anything about the back pain, you would fuse the patient's spine.
Right.
You could either do nothing except remove the disc or open the canal up and leave it at that, and that would help the leg pain but not the back pain. Or you could fuse the patient's spine, which is a very big operation and with quite a lot of complications and problems arising from fusion surgery. So the Wallace is an in-between. It's what we call a soft stabilisation. We don't fuse the spine, we insert this device to support the spine.
Could you tell us exactly how the Wallace ligament works?
Yeah, the best thing is to show you in action. This is a Wallace in a plastic model of the spine that's not quite been fully inserted because we've not tightened the straps, but basically the Wallace is this plastic device which is sitting between two bones in the lumbar region. You only use it in the lumbar region, and it's got straps of polyester around the bone above and the bone below, and it works firstly by sharing the load on the disc at this level, and this one's between the third and the fourth lumbar regions, and also restricting movement, because the pain that you get from degenerative disc disease results due to movement, either abnormal movement or excessive movement in the disc, or excessive loading in the disc. So this little plastic device, as you can see, especially if we did tighten these straps and cut them short, would prevent extension in that segment. So you can see that it just is an extension block.
Right.
And then having the straps around the vertebra above and below, if they were tightened, would actually reduce flexion. The idea being, if you reduce these movements, the pain is reduced from the degenerate segment, but it also supports the segment during everyday activities, regardless of movement. It offsets some of the load from the disc that might be the source of the back pain.
And how long does it take to put one of these Wallace ligaments in?
You always do it towards the end of the other operation, which might be a discectomy or a decompression operation, and it takes 20 minutes to do that. 20 minutes extra beyond the hour or the hour and a half, whatever it takes you to do the basic operation.
Right. Okay. And are the patients mobile the same day?
Yes. Having the Wallace doesn't make it much longer or bigger an operation, although it's a slightly longer wound. It's going to be about 6 or 7 centimetres a wound to insert a one-level Wallace. You can have more than one in the back if you want to put 2 in, or even 3 in. You can do that. So the wound's a bit longer than a micro discectomy wound. Right. And we certainly haven't been sending patients over the same day, but some are going home the next day, and probably mostly, say if we do it on a Monday, we'd send the patient home on a Wednesday.
Okay. How long have these Wallace ligaments been in use for?
Jacques Senegas, a professor from Bordeaux in France, who I visited before we started doing this, has been doing them for 20 years. But the new device, the plastic device, as opposed to the original metal device, has been in the market since 2002.
So he's been doing it for 20 years. Is there lots of evidence to show that they're effective?
His results, his personal series, are very impressive if you go up to Bordeaux and listen to him speaking and see the way he's followed up all these patients. There is now proper research evidence in the condition of spinal stenosis in patients requiring decompression, that adding a Wallace in to a randomised half of the patients means that they'll get a better result in terms of back pain 2 years down the line. like all instrumentation in spine, organising and running and giving results from a randomised trial takes time, but the results from one trial centred in the UK are now out, and it does seem to work.
Great. Okay, thanks.